Hello, I'm Donna Walsh, Health Officer for the Florida Department of Health in Seminole County and your Healthy Seminole host. Half of all Americans live with at least one chronic disease like heart disease, cancer, stroke, or diabetes. These and other chronic diseases are the leading causes of death and disability in America, and they are also a leading driver of healthcare costs. Most chronic diseases can be prevented, and if you have already been diagnosed, there are resources that can help manage the disease. Today we will learn about some chronic diseases, their risk factors, and how to manage and prevent them. Type 2 diabetes is one of three main types of diabetes. It is when the body is unable to keep blood sugar at normal levels. Here to share how diabetes can be prevented or managed is Sarah Wright, Executive Community Health Nursing Director for the Florida Department of Health in Seminole County. Welcome to the show, Sarah.
Thank you for having me, Donna.
So Sarah, tell me about diabetes. Who is at risk for developing diabetes?
Diabetes is a chronic disease. It should be diagnosed by a primary care physician. You should have your blood tests drawn, your glucose level, and really what it is diabetes is when you eat, the food that you eat is fuel for your body. Mm-hmm. The fuel gets broken down into sugar. The pancreas then comes in. The pancreas is an organ in the body that comes in and it determines how much insulin is needed to combat the sugar that's in your bloodstream. And so when you're diagnosed with diabetes, the insulin that the pancreas is producing is not working enough. So you need medications to kind of level off the blood sugars in your body.
And then what are some of the risk factors people may have for diabetes, for developing diabetes?
Some of the risk factors are if you are overweight, mm-hmm. If you're over 45 years of age, if you don't live a healthy lifestyle, you have to watch your diet, you have to exercise, and if you have family members like parents who have had diabetes, siblings who have had diabetes, who have been diagnosed with diabetes, you're at risk for having it. Also, if you've been diagnosed with pre-diabetes, there's a likelihood that you will develop diabetes.
I see. So Sarah, for people who are at risk, what should they do or can they do to prevent diabetes?
Okay. The first thing you can do is see your primary care physician. Get your blood tested to ensure that you do have, mm-hmm. Or that you may think that you have it. And once you are diagnosed either with prediabetes or diabetes, you will be put on medications. It's really important that you follow up with a diabetic educator. But the important things actually is this for you to eat a healthy diet, mm-hmm. to exercise at least 3 times a week, to monitor your glucose frequently, and to live a healthy lifestyle. Watch your calories and your fat intake.
Okay, very important messages. Sarah, tell me about some of the programs that are available for folks who are either pre-diabetic or diagnosed with diabetes.
There are some research programs which are evidence-based programs, which is the National Diabetes Prevention Program, very well-known program in partnerships with various organizations. And what they do is it's a year-long program. First you start off going every week, mm-hmm. and then as it levels off, you start going every month. Okay. And really what it does is it teaches you from how to shop for healthy foods in the supermarket, how to get enough rest, how to increase your physical activity, going from like couch to like a mile of walking. It seems really hard for some people, but it's doable because it has been researched. Sure. And so it really just focuses on a healthier lifestyle and a healthier way of living.
So what are some of those programs called, and where can people take advantage of those programs? What locations?
Most of these programs you can find on the American Diabetes Association webpage. You can find them on the CDC webpage. You can visit the health department. We have some programs in the health department. We have the National Diabetes Prevention Program at the health department, and in October we are going to start the Diabetes Self-Management Education Program. That program differs because this is for clients who have been diagnosed with diabetes already, who are on medications, and it's a 6-week program where we help you and guide you through the process. What the studies have shown is with diabetes is that the clients that have been diagnosed with diabetes just need constant monitoring and education and support. And that's what the Department of Health will be doing for those clients.
Oh, that's excellent. So Sarah, what would somebody who thinks they may have diabetes ask their doctor when they go to their doctor's visit?
There are some symptoms. If you feel that you're very thirsty, if you're losing weight without trying, because most of us try to lose weight, but if you're actually losing weight without trying, if you find yourself very hungry, if you have blurred vision, if you have numbness and tinglings of your hands and feet, if you feel tired all the time, if your skin is excessively dry, if you have sores that heal slowly, and if you have chronic and frequent infections. That's some of the symptoms that you might want to go see your doctor.
And Sarah, is there a test that someone can do at home?
Absolutely. And actually, rather than doing it at home, the first test should be done at your primary care physician's office. There's what we call an A1C, and that tests your blood level over a period of time, over about 3 months. And so in the office, if that test comes out, let's say 5.7 or higher, that means that you're predisposed to diabetes. If it's 6 or higher, then it means you have diabetes. And right there and then you'll start getting education. And it's important for you to follow up with an endocrinologist. That's a doctor who specializes in diabetes, clients who have diabetes. And it's also important that you follow up with an education and a support group class.
Thank you so much, Sarah, for sharing about diabetes today.
You're welcome.
Most chronic diseases are caused by key risk behaviors. You can reduce your likelihood of developing a chronic disease and improve your quality of life by making healthy choices such as quit smoking. Not smoking or stopping if you already smoke lowers the risk of serious health problems such as heart disease, cancer, type 2 diabetes, and lung disease, as well as premature death, even for longtime smokers. Please call the Quit Your Way hotline for free support. Eat healthy. Eating healthy helps prevent, delay, and manage heart disease, type 2 diabetes, and other chronic diseases. A balanced diet of fruits, veggies, whole grains, lean meats, and low-fat dairy products is important at any age. Get regular physical activity. Regular physical activity can help you prevent, delay, or manage chronic diseases. Aim for moderate physical activity like brisk walking or gardening for at least 150 minutes a week. Avoid alcohol. Over time, excessive drinking can lead to high blood pressure, various cancers, heart disease, stroke, and liver disease. By not drinking too much, you can reduce these health risks. Get screened. To prevent chronic diseases or catch them early, visit your doctor regularly for preventive services. Keep your cholesterol and blood pressure at normal levels. Get enough sleep. Insufficient sleep has been linked to the development and poor management of diabetes, heart disease, obesity, and depression. Adults should get at least 7 hours of sleep daily. Know your family history. If you have a family history of a chronic disease like cancer, heart disease, diabetes, or osteoporosis, you may be more likely to develop that disease yourself. Share your family health history with your doctor, who can help you take steps to prevent these conditions or catch them early. Maintain a healthy weight. Limit screen time and choose to eat balanced meals and engage in physical activity, such as walking with a friend or walking your dog. Stay upbeat and avoid stress. Control stress by engaging in healthy activities. Reach out to family and friends or a support group in time of crisis, and take time to relax. By making healthy behaviors part of your daily life, you can prevent conditions such as high blood pressure or obesity, which raise your risk of developing the most common and serious chronic diseases.
Shepherd's Hope is a nonprofit, faith-based organization of volunteers that exists to provide access to health care for the uninsured. Myrna Chamorro is on site to learn more on how Shepherd's Hope is a health resource for the uninsured.
I'm here with Jean Zambrano, Vice President of Clinical Operations for Shepherd's Hope. Welcome, Jean.
Thank you.
Tell us a little bit about what is Shepherd's Hope.
So Shepherd's Hope is a faith-based nonprofit that provides free health care to folks in the community who do not have insurance and are at low or no income, and we do it all through volunteers.
Wow, that's a great resource to have here locally. So what type of services are offered?
So we see folks that have primary care needs as well as some secondary specialty care needs, and it's dependent on the type of volunteer doctors that we have coming in each night.
So how many locations do you have here in the community?
We actually have 5 health centers throughout Orange and Seminole County. Here in Longwood is actually our most offerings of clinics. We're open 4 nights a week, Monday through Thursday, and then we're open Monday, Tuesday, and Wednesday mornings.
When a patient decides to come and visit one of the clinics, what can they expect?
So the first thing they can expect is to be greeted by our volunteers to get them registered and to see if they qualify for our services. They do have to be at 200% of the federal poverty level or less. They have to have no health insurance, so no Medicare, no Medicaid, no private insurance. And then they'll have an opportunity to meet with one of our volunteer nurses that'll do the initial triaging, and then they'll get to see one of our doctors that can help them with whatever their particular need is that night.
What happens if someone has a chronic condition and needs to have ongoing care?
So a couple things happen is we work very closely with the community health centers or the federally qualified health centers in our area to get patients connected for their ongoing care for their chronic conditions. In addition, we also will help with any episodic needs that they may have in the interim. And then the third piece is we actually have care coordinators within Shepherd's Hope that will help connect folks to community programs that are out there that they may be able to benefit from that maybe we don't offer. So together we work to kind of give the patient ongoing care and resources, or connect them to resources.
Yes. Leave us with an important message that you would like the viewers to know about Shepherd's Hope.
So the amazing thing about Shepherd's Hope is the amount of volunteers that actually come each night to see our patients, our doctors and nurses, and even our general volunteers that come out, whether it's greeting a patient or getting them checked out for the night and getting their orders and where they should go next for their course of treatment. And the reality is that we're seeing more and more patients. The capacity, there are nights where we're turning patients away because we don't have enough doctors to see those patients, and so we still need more volunteers. So please, anybody that's interested in volunteering with us, please reach out to us. You can go right onto our website and you can actually fill out an online application. The last thing we want to do is have to turn somebody away at the door that really needs that help and say, I'm really sorry, we can't help you tonight, and have them come back another night. We know that that's really difficult.
Thank you so much, Jean, for all that you do and for all that Shepherd Hope does here in our community.
Well, thank you so much for being out here today.
The Community Paramedicine program allows patients to receive home chronic care visits when ordered by their physician and helps prevent additional emergency hospital visits. Here to share more on this program is Ken Peach, Executive Director for the Health Council of East Central Florida. It's great to have you with us today, Ken.
Thank you, Donna. Glad to be here.
Hey, Ken, tell me about the Health Council and some of the services and initiatives that you're involved in.
We're actually 501c3s. We're nonprofit organizations, and so we reflect what it is our community needs. In our particular case, we do needs assessments for the behavioral health, for various community needs. We then use that to find partner organizations, for-profit, not-for-profit, that we can work with to address the issues, and then ultimately we also go ahead and evaluate the outcomes of those initiatives.
So Ken, I've heard recently about a community paramedicine program that the Health Council initiated. Can you tell us more about that program and the partners involved?
It's very unique, Donna, and probably the biggest confusion we found with the physician community is they expect paramedics, like most people, to come on an ambulance.
Sure.
And 99% of the community paramedicine programs in the country are using firefighter paramedics to help reduce the individuals who are using the 911 and the emergency department over and over again because no one's interacted or intervened, I should say, into the cause of why are they doing that. But our program is completely different. We recognize that if we worked with physicians to extend their care into the community, we could begin to address the growing preponderance of chronic disease as opposed to acute disease. So your normal paramedic will go out and they'll go ahead and they'll triage the problem, they'll treat the problem in the field, and then they'll transport the patient to the hospital. In our case, we go out to heart failure patients, diabetics to individuals with COPD or breathing, respiratory issues, and we will help them manage their health issues in their home.
That sounds excellent. Can tell me a little bit about community health workers and how they're working with the paramedic program.
We were able to train 10 community health workers in the community, actually at the health department, in a 3-hour assessment course of how to assess a home to see if it's healthy. Everything from radon through insect control, through the mold remediation and all the different things that can make a house less than healthy. And so now what we're doing is using those health workers to connect individuals when we identify, the paramedics in the home identifies that there's no screens or that there's a leak somewhere, can work with the health workers to find assistance.
That's excellent. Can you walk us through what a client might expect when they receive a visit from a paramedic?
Yes. First of all, two things have to be done. First, their physician has to refer the paramedic to them. The paramedics cannot see the patients without that physician referral.
Okay.
The second thing is the patient themselves have to say, I'd like to have this done.
Sure.
So we use a card to introduce the paramedics so they get to know them a little bit before they arrive. The first visit, the paramedic does a home assessment. So they're assessing for fall risk in the home. Is the home a healthy place? What is the likelihood for example, is there food in the cupboard? And let's say it's a diabetic patient, is it the proper type of food that the patient's having? So they can assist in that a little bit, nutrition education. We can look at causes of anxiety or depression, are those present? We can check air filters. You can imagine on asthma patients, quite often the individual now with asthma won't know that there's air filters have to be changed. We can check to make sure there's batteries in the smoke detectors. So we do a complete assessment. Aside from the clinical evaluation of the chronic disease, the vital signs, which we do every time, all of this reported back to the referring physician. So they're constantly getting feedback on the care of that individual in the community.
Ken, what an innovative way to deliver health care. Where do you see health care going in the future with programs like this?
Well, of course, Donna, we had a healthy collaborative program.
Right.
And when I first got engaged in that, when I first came to the community about almost 8 years ago, I drew a pyramid, and the pyramid had the hospital at the top. And as a former hospital administrator, I know that that's the most expensive place to deliver care, and the place that most people don't really want to be.
Right.
So if you look down, the next step on the pyramid, the greater utilization and the lower cost is to see the patient in their own primary care physician's office, a physician specialist, an outpatient center of some sort. But ultimately, my point at that was there's an awful lot of other care that could be provided in the home. And so for the last 7 to 8 years, we've been trying to position the Health Council to help us begin to do more at the home. So community paramedicine is a way of initiating and providing care in the home.
It makes sense, Ken. Thank you so much for sharing the community paramedicine program with us today and all the other initiatives that you're involved in.
Thank you for the opportunity.
Asthma affects more than 26 million Americans. It is a chronic disease that causes your airways to become inflamed, making it difficult to breathe. The best way to manage asthma is to avoid triggers, take medications to prevent symptoms, and prepare to treat asthma episodes if they occur. There are resources in the community to assist anyone living with asthma. To tell us more about a local asthma support group is Myrna Chamorro.
Joining me is Midge Wilson. She is a board member for the Let's Kick Asthma Foundation. Welcome, Ms. Wilson.
Thank you, Myrna. Thanks for having me.
It's wonderful to have you here and this Let's Kick Asthma Foundation. Tell us, what is Let's Kick Asthma?
Let's Kick Asthma is a nonprofit foundation founded by my sister, JoJo O'Neill of 94.5. It's nonprofit, and she's working on getting scholarships for students that study pulmonology and students that study allergies.
That's wonderful. So we have a foundation, but I understand there's a support group within the foundation. Tell us about that.
There's a support group in the foundation, and the support group is very helpful for people that have asthma. They come out and they share their stories, they share ideas on what they've found, and some bring clippings and things, what they found, and they share it with others there. And we even bring in professionals, doctors, nutritionists, and fitness trainers.
So why is for a person that has asthma, why is the support group so important?
The support group is important because you need to know it is about education, and you need to know. Sometimes you're afraid to ask your doctor, and you go home with your script and your medication, and you're afraid to ask the doctor, well, what do I do with it? And they come back and they don't know. And by having the support group, we have the tools there to tell them, this is how you use your inhaler, this is how you use your peak meter, this is how you use your nebulizer. So it shares a lot of information, education.
That's great. Thank you so much, Ms. Wilson, for this great information, for all that you do, and for Let's Kick Asthma.
Thank you so much for having us.
Heart disease is the leading cause of death in the United States. More than 600,000 Americans die of heart disease each year. That's 1 in every 4 deaths in this country. Having high cholesterol, high blood pressure, or diabetes also can increase your risk for heart disease. Joining me now is Dr. Raj Saxena, cardiologist and volunteer for Shepherd's Hope, to talk about preventing and managing heart diseases. Thank you for joining us, Dr. Saxena.
Sure, you're welcome, Don.
So, Dr. Saxena, tell us about heart disease and what are the risk factors associated with it?
The risk factors are, like you mentioned, diabetes, hypertension, smoking, big one.
Sure.
Lack of exercise, that's a sedentary lifestyle, is one. And the uncontrollable factors of heart disease are like, like the heart disease runs in the families, some of the families, that's one. And age, that is the most thing, like the older you are, the higher the risk.
Sure.
And then male sex, like, usually it's seen more in males than females.
Okay. So, Dr. Saxena, what do we mean by heart disease? What sorts of complications does that include, or diagnosis do we often hear about when we mean?
Okay, heart disease is of various kinds, but the most common is the coronary artery disease, by which I mean the narrowing of the vessels of the heart, or the blockage of the heart. That is the most common. And then the second common is the hypertensive heart disease, which which you see in hypertension. And then you have irregular heartbeats. That is another heart disease called arrhythmias. And so there are different kinds of heart diseases, but the most common, which is the #1 killer in USA, is the coronary artery disease.
So Dr. Saxena, what other diseases are associated with heart disease besides stroke and circulatory issues?
Hypertension, diabetes, and smoking is there.
Okay.
And obesity. Any male having a waist size of more than 40 inches is at the risk of a heart disease. Any female with a waist circumference of 35, of anything more than 35, is at a risk of a heart disease. And basically lack of exercise, which ties in with the weight.
Okay. What types of screenings can be done to detect heart disease in individuals?
At the age of 35, an EKG could be done as a screening, and then every year after. And then the stress test is not recommended as the mass screening for heart disease. I think when you get some chest pains, when you get some palpitations or heavy heart disease, or the heavy heart rate, or you get some shortness of breath, or a person is feeling lightheaded or passing out, then he needs to go to a doctor, and then the doctor can recommend a stress test.
Okay.
So that is the first test which we usually do.
Okay. And what are some of the treatments for heart disease, and how does someone manage their heart disease once they're diagnosed?
Essentially, what a person can do is take care of food and fitness, to simplify that as. And foods are, you can try to get your diet to get more into a plant-based diet.
Okay.
that is avocados, and fill your plate first with the plant-based diets, and then
Okay.
whatever is left, then you can go to the animal-based diet. And the plant-based diet, and also fish like salmon or tuna.
Nice.
Those are all good things for the heart. And then the red meats, which are not good, like anything with the animal-based, and full dairy, like a full-fat dairy, is another one, and the red meats is along with that. So try to keep away with that, like from that, and trying to concentrate on plant-based diet. And then fitness, one needs to exercise for about 150 minutes a week.
Okay.
So try to walk for 30 minutes a day, most days of the week.
That makes
is
sense.
one good thing.
Yeah.
So that is one way to manage. And then the second thing is take care of your high blood pressure, like take care of your diabetes, take care of your hypercholesterolism.
And are there medications that some people have to take to control their heart disease?
Yes, there are a lot of medications, and in the last, say, 10, 20 years, the heart medications or the treatments for heart disease have really come a long way.
Oh, okay.
And they are called the beta blockers, and then like the hypertension needs to be treated. And a basic aspirin a day can really help a person, like prevent the heart disease and treat it. So beta blockers are given whenever you see a heart disease patient with the coronary artery disease, and then basic aspirin, and then we can go like more deeper into the different medications we can use depending on what we have with the patient.
Dr. Saxena, would you like to leave us with a message for our audience regarding heart disease?
First of all, is fitness and food. And the second thing is be regular to your doctor's visits. Just follow the doctor's orders religiously. And just realize that it's the number one killer. So do not take it lightly.
Absolutely.
And I think a person, today, if he does what we talked about, and with the modern advances in the, cardiovascular medicine, there's no reason one could not have a full life.
That's very encouraging, Dr. Saxena. Thank you so much for joining us today, and thank you for your service to our community.
You're welcome. You're welcome.
Americans are living longer, but chronic diseases like diabetes, heart disease, and cancer are taking a growing toll on the community's health. The good news is that through effective behavior change efforts, appropriate medical management, and regular monitoring to identify new problems, chronic diseases and their consequences can often be prevented or managed effectively. Thank you to our distinguished guest for joining us today. I'm Donna Walsh for Healthy Seminole. See you next time.